And now, Dr. Hernandez, our future. Let's hear what you have planned for us. It's always good. Thank you.
Thank you. That's a pretty hard act to follow. Well, first I want to say hola, buenos dias. It's great to be here. Thank you so much for giving me the opportunity to speak. And I apologize now because I'm not going to be talking about disparities, but rather the actions that us at Morehouse School of Medicine are doing. So, do I click the slides here or the green button? Okay. So, this quote. The reason why I love this quote is because it's so powerful, but yet so simple. It's at the very essence of community engagement, which is what I love to do. We have many concerned people, but how many of us, if we are really concerned, take time to get to know our next door neighbor before we even begin to help them? We think we have all the answers, and we rush to go help our community members, but do we really know them? This should be an important goal for each and every one of you to get to know who your neighbor is. To achieve, at Morehouse School of Medicine, our vision of leading in the creation and advancement of health equity required us to even take a few steps back and take a deeper dive to really know who we are serving and to establish the trust of the community. Because we are in the center of a community that has a lot of distrust. A community where the median income is only $18,000 a year, where 97% of the community is African American and in the midst of gentrification, where we have the highest rates of HIV/AIDS, equivalent to rates in third world countries. That's where we're at, and these are the people we're getting to know. You see, at Morehouse School of Medicine, we demonstrate our social mission through actions. We don't just talk the talk, we walk the walk. We have the first woman president of a freestanding medical school. That's walking the walk. We develop graduates who practice in underserved areas, who diversify the healthcare workforce, who close the divide and help alleviate patient-provider relationships. We bring the latest knowledge and the best practices to health professions. But what makes all of this happen, what's central to everything we do at Morehouse School of Medicine, is community engagement. The audacious undertaking of what we do is only possible by collaborating with our neighbors, with the people we serve and earning their trust, and by working genuinely with our community. We develop transformative approaches, and that's where we're heading towards. So a lot of the conference was about education, but we educate for social change. That's how you develop learners and future leaders to become agents of social change. We support our institutional mission through these engagement activities. And everything we do in our educational programs at Morehouse School of Medicine is centered around community engagement, beginning with our learning communities, in which we have small groups of 4 to 15 students and faculty who talk about issues like cultural sensitivity. It helps develop future leaders and create small groups where we develop communities within ourselves. Then we have our community health course, which I think some of you were able to attend our student presentations yesterday and who did a phenomenal job. For more than 2 decades, Morehouse School of Medicine has trained its first-year medical students in community engagement and service learning via a year-long community health course. And we use this to train community-oriented physicians, not just a patient-provider relationship that happens in an office, but having the students realize that it goes beyond that room, that the problems that you're trying to solve are way beyond the physical symptoms that someone is feeling, and particularly in our community. As Dana mentioned in this class, we do discuss things like racial bias, like race and systemic oppression. We talk about the social determinants of health. We prepare them for the realities that they're gonna face when they're out there working in these underserved communities. Another thing that we're doing is that we know that at Morehouse School of Medicine, we're in an urban community, but as Dana mentioned, our rural communities are suffering as well. And so we have a program expansion where we have a campus now in Columbus, Georgia. And this provides students with invaluable experiences to be able to practice and learn about rural health, and particularly our communities in these areas. We also know that we need interprofessional collaboration, and so we started a PA program, and this is to increase the number of minority healthcare workers and extend its reach in underserved communities. And I can go on and on. We have our community preceptorships. I mean, these are amazing opportunities for our students to be engaged in the community and learn about community health. This is an example of what social change and community engagement in education can do. Now, this just seems like a simple picture, but that crosswalk and those signs were never there. Adamsville Green Senior Apartments over the last several years has been the focus of one of our community health sites. One of the major issues that our students uncovered was that it was dangerous for the elderly residents to cross the street due to traffic conditions. And there was a lack of a crosswalk and a traffic light. This is an issue that the students helped to address for 4 years in a row. Every single time a new MD1 class came in, they would tackle the same issue over and over. What the students did was train and work with the residents on mobilization, on being an advocate for your community. And finally, this crosswalk and pedestrian lights was installed because of the hard work of our students, because of their advocacy, their role. As Dana mentioned, they didn't just go in to their government offices or to talk to their residents about the needs that they had, but they went and advocated on behalf of their future patients and their communities. And this crosswalk was finally installed just a couple of months ago. So kudos to our students. We also do a lot of research for social change. Our faculty in OBGYN, medicine, family medicine, community health, and preventive medicine conduct my favorite type of research, which is community-engaged research. This includes both participatory research conducted in the community at large through our centers and institutes like the Prevention Research Center and our Satra Health Leadership Institute, and research conducted in practice-based networks through the National Center for Primary Care and our Clinical Research Center. Additionally, we lead the Community Engagement and Research Program of the Georgia Clinical Translational Institute, a collaboration between Emory, Georgia Tech, Morehouse School of Medicine, and the University of Georgia. Our community engaged research includes projects that were identified as priorities by our community. So we don't just go in and work on health issues that we believe are important, but we work on health issues that were identified by our community, and we work with them and develop programs and prevention and research that is useful for our communities. Additionally, we're on the ground with our communities. We have community health workers, which have a big fingerprint throughout Morehouse School of Medicine, across our departments, our centers and institutes. We call them sometimes patient navigators, health worker, community health workers, promotoras, community liaisons, many names. But one of the programs I wanted to highlight is the fact that we start early, and we have a high school community health worker training program. And through this program, we developed a network of community health workers that start early and learn through shadowing experiences, core competencies. They are actually monitored by the community and the families that they are serving, and oftentimes leave with opportunities for employment after they graduate from this program. And then Morehouse Healthcare, with over 200 physicians providing compassionate care, working with Grady Hospital. And our HEAL Clinic, which is a clinic run by our students and faculty that offers free services for those that are most affected by health issues and don't have the access to care. And then our Office of Community Engagement, knowing that this was central to our mission, putting resources into establishing this and making this huge, and having one of our signature events, which is our Community Engagement Day, which brings over 500 residents when we open the gates at Morehouse School of Medicine. A lot of our community members loved this event and said, I've never even stepped foot on a college campus before until today. And then our Office of Global Health Equity, knowing that issues don't just happen in our backyard, but we're all interconnected. And we see that with pandemics and different things that happen across the world. Knowing that our goal is not out of the realm of possibility to solving the world's health issues, not just the health issues in our backyard. But there are still a lot of opportunities for us and all of you here in the room, because we do have some changing demographics. I don't see too many of my people here, but we're one of the fastest growing populations in the country and in the world. And the largest Latino population in Georgia is the Mexican American population, which is the second largest population of Latinos in the world. And we're on the move with that and in working with these populations, because we have to diversify. As our community changes, so do we. And we're doing that at Morehouse School of Medicine. And then also the future of allied health and medical education. New ways of teaching, new ways of thinking, the advent of technology, artificial intelligence, all these things that are happening. We're on the cusp of that, and we're attacking that right now and working with our students to address this. And the change happens all the time, but it begins with engagement, whether it's among nations, whether it's among technology, systems, organizations, or individuals. And one thing I wanted to highlight about today, and Dana I forgot who mentioned this, but I think it was you, Linda, the quote, "Be the change you want to see." And Morehouse School of Medicine really believes in that. Because today we could have had our wonderful president be up here and speak on behalf of Morehouse School of Medicine and tell you about all the wonderful things that we're doing. But they chose to have me represent them instead, because they believed that I am that change for this country and for Morehouse School of Medicine. You see, I started at Morehouse School of Medicine as a postdoctoral student under Dr. Satcher in the Satcher Health Leadership Institute. And at the time, they believed in me more than I believed in myself. And they invested in me and offered me a faculty position. You see, I am those communities that everyone wants to serve. I come from the South Bronx. I experienced premature death in my family. Every single woman in my family had a pregnancy before the age of 20. I have a brother who is autistic. I had a grandfather who died from colon cancer because of racial bias and systemic oppression, because people felt that their way of treating him was the best way, and it wasn't. But we were uneducated and we didn't know. And that pushed me to be where I'm at today, to be able to talk to you about my passion for healthy communities. These personal experiences and these significant public health challenges led me to pursue a career where I'm at and want to work at Morehouse School of Medicine, a school where within their vision statement, and Sir Michael Marmot pointed this out, health equity is in our mission statement. It's in our vision, because that's what we're about. We walk the walk. My future career plans with respect to health equity are tied directly to me as a researcher and a woman of color. I am here to strengthen health programs and policies, to reduce ethno-racial healthcare disparities, and ensure that all people receive quality, comprehensive, culturally appropriate care. The future of America will be increasingly influenced by the success or failure of improving the health of our nation's fastest growing population, ethno-racial minorities, and other disadvantaged groups. And I hope to be a part of the solution and working with Morehouse School of Medicine. I'm honored and privileged to be able to be a part of every single program I mentioned to you today, because it takes a team to do what we do at Morehouse School of Medicine. I have 1 minute left, but I also want to give a nod to all of the young Flexners here in the conference who presented their work and believe in this social mission of creating change, of community, diversity, and inclusion. I thank you so much for all that you do. Lastly, I just want to thank Dr. Montgomery Rice for allowing me to speak today, Dr. Anachabe, and Dr. Virginia Floyd, who I don't think she's here in the audience. But all of them have instilled so much in me, And I have amazing leadership to look up to know that that's where I'm going to be one day. I might be the first Latina president of a medical school. You never know. But thank you so much, and I hope that this message resonates with you, and for all of you that are in the audience, do not give up on your dreams. Believe that you can do this, but we still have a lot of work to do, and you have to be steadfast and don't give up, because this is the hardest work. It's so frustrating because we want outcomes so quickly, but they don't happen. But I believe that Morehouse School of Medicine, through these programs, can achieve that. Thank you.
So the youngest is leading us. What a great, inspirational talk, Dr. Hernandez. Thank you very much. And I know this audience is ready to line up at the mics.